Good. Ini kelas paling awal yang you guys ada ke?
Fine.
Betul.
Oh betul. So usually start at 9 o'clock.
Betul.
Okay. Alright, tak apa. Kita start juga awal sikit sebab you guys ada next class pukul 11, saya pun ada kelas pukul 11. Sorry sebab semalam saya tak boleh proceed dengan kelas, ada hal yang saya kena settlekan. Alright, so for today's session, I'm going to share with you okay. So boleh nampak ke my slide?
Boleh.
Alright, okay. What are we going to discuss today is more on the assessment of hemostatic function. I believe you've learned about the hemostasis before this last semester in hematology subject. So we are going to discuss about the coagulation disorder tests that involve the coagulation cascade. Okay, so what are we going to discuss today? It involves a few coagulation disorder, and this coagulation disorder help to identify patients with hemostatic defects that could cause excessive bleeding. So it involves the first one is the prothrombin time or PT, and the second one is the activated partial thromboplastin time APTT. The third one is the thrombin time, TT, fibrinogen assays, and also the platelet function testing. It's more on the tests. We are going to discuss about this test because this test can help to identify patients with the hemostatic defects that could cause excessive bleeding. So kita akan berlega-lega dalam 5 test ni, insyaAllah. Alright, before we proceed with the coagulation disorder, it's more on refresh balik semula ya, in terms of hemostasis. So when we talk about the hemostasis, the words of hemostasis and homeostasis look and sound very similar, right? So what would be the differences between this hemostasis and homeostasis? Anybody? Sebabkan ni pagi kan, jadi kita kena jump start dengan soalan-soalan untuk activate. Jangan ada yang left pula. Apa beza hemostasis and homeostasis? Anybody would like to give a try? Sama ataupun tidak hemostasis and homeostasis?
Tak sama doktor.
Tak
Tak
sama.
sama.
Okey, tak sama. Okey, saya dengar tadi ada beberapa orang cakap tak sama Nabahan dengan Haizatul. Okey, Haizatul, what is the difference? Hemostasis dan homeostasis.
Hemostasis relate with the blood cell, hemoglobin.
Okay. Homeostasis?
Homeostasis.
Homeostasis, I believe you guys learned the homeostasis about the feedback control system in anatomy or physiology, right? So when we talk about the hemostasis or homeostasis, the main difference would be the hemostasis is the mechanism that helps the circulatory system to perfuse the right organs, where the homeostasis is also the mechanism by which the biological system to maintain an equilibrium state. So usually in homeostasis, we're talking about the system of feedback controls. ada feedback control positive or feedback control negative. Okay, so when we talk about hemostasis or hemostasis is a process or is a mechanism to prevent and stop bleeding, meaning to keep the blood within a damaged blood vessels. So basically the hemostasis means arrest of bleeding. So what happened during hemostasis? It involved several mechanisms interact to slow blood flow. How to slow the blood flow during this hemostasis agaknya? How the body, how the mechanism in order to slow the blood flow dalam hemostasis? Anybody like to give a try? Macam mana badan nak slow kan the blood flow tu? Sorry?
Blood clotting.
Blood clotting, or usually at the initial phase, the initial stage involve the vasoconstriction. Yeah, which is kalau ada berlaku vascular injury for example. Yeah, in order to, kalau tak berlaku tak slow the blood flow, what happen? The blood flow akan keluar seronok je lah keluar daripada blood vessels. So usually the initial stage would be the vascular phase, which is the vasoconstriction. And then block the vessel wall with block the vessel wall defect with the platelet plug. Usually this would be in the primary. Okay, usually so the vascular phase involve the vasoconstriction, and then the platelet plug or platelet activation, and this is in under the primary hemostasis. And then convert the fibrinogen to a jelly-like fibrin clot. It involves the coagulation cascade, and then later re-establish the flow of blood through a mechanism of slow clot lysis. We call it as a fibrinolysis. Okay, so the platelet activation, the vasoconstriction is under the primary hemostasis. When you talk about the fibrinolysis and also the coagulation cascade, so this complex physiological processes may be divided into these 4 phases. Phase. Now, my question is, under the coagulation cascade, how many coagulation factors? Ada berapa group of coagulation factor? How many? Kita banyak sesi soal jawab supaya pagi ni kan. Anybody would like to give a try? How many coagulation factors kita ada? Ada. Yeah, no Azhar, 12. Yeah, we have 12. Tapi kalau you guys refer to the coagulation factors punya table, dia ada coagulation number 1 until coagulation number 13. Which number missing dalam coagulation factors punya table or group ni? We've mentioned 12 coagulation factors, but the numbers of coagulation factor is started with the coagulation number 1 until coagulation number 13. My question is, which number missing dalam coagulation factors? Yes, coagulation number 16, Shakira. All right. So before we proceed with the coagulation disorder test, what would be the medical importance of this screening test? Okay, so basically the screening test of hemostasis were developed to help identify patients with hemostatic defect, kegagalan ataupun kerosakan that could cause excessive bleeding, and the screening tests are available for each of the phases of hemostasis. Kita dah lihat tadi dari refresh balik semula, involve the coagulation cascade, the platelet plug formation and the fibrinolysis. So each of these phase of hemostasis ada coagulation, ada screening tests that will be involved. And these tests are used very commonly in clinical medicine, both to help predict hemorrhage at the surgery and to identify specific defects in patients with a history of excessive bruising or bleeding. So this one of the reason kenapa kita buat this screening test, especially di surgery, sama ada nak tengok dia berjaya atau tidak. Sebelum kita nak lihat dia surgery is berjaya ataupun tidak, we need to do the screening test in terms of the coagulation, especially the coagulation factors. Sebab kita kena prevent awal. Kalau takut yang this patient mungkin ada kurang certain factors, benda tu. Sebab kalau tak, kita proceed the surgery without do the screening, what will happen? Takut the patient lost blood extremely. Okay, and then based on this information of this screening test, we can administer appropriate therapy, or apa benda yang kita nak masukkan dalam patient tu. Okay, so mungkin kita boleh masukkan the fresh frozen plasma, clotting factor concentrates for coagulation defects, platelet transfusions, or VWF concentrates for platelet function defects, or antifibrinolytic agents for systemic fibrinolysis. So ni reason kenapa perlu buat this screening test in terms of the medical aspect. Okay. Then what would be the coagulation disorder test involved? Yang biasanya kita practice in the lab. So usually kita akan buat the CBC. We call it as a complete blood count, involve the platelet count. Kenapa kita measure the platelet count? Obviously platelet involved dalam preventing daripada berlakunya hemorrhage. Kita buat smear. Smear, I think today saya rasa after Zuhur ada practical session nak buat blood smear, right? Okay, betul. Saya kira. And ada another test that always been performed in the lab, PT or prothrombin time, or APT, activated partial in time fibrinogen AC. And this test narrow the diagnostic possibility for the testing. So bila kita dapat all this information, kita boleh identify, kita boleh interpret the results, normal, abnormal, high or low. This is particularly ada penyakit apa. Now, again, kita refresh lagi about coagulation cascade, coagulation pathway. Coagulation pathway cascade ni is very complex, but very at the same time it's very interesting. Okay, now my question is, based on this figure, boleh saya dapatkan Mizan? Mizan ada? Mizan dah masuk? Belum. Mizan ada? Tak ada. Mungkin boleh Farihah ada? Farihah?
Yes, saya doktor.
Okay, Farihah. Based on this figure, ada berapa pathway? How many pathway, and name the pathway?
3 pathways, intrinsic pathway, extrinsic pathway, and common pathway.
Okay, so we got 3 main pathway dalam coagulation cascade. Okay, now next, Hayati. Can we have Hayati?
Yes, doctor.
Okay, Hayati. What type of coagulation factors yang ada dalam extrinsic pathway? Hayati?
Hagaman factor.
Dalam extrinsic.
Extrinsic. VII.
VII tu faktor nombor berapa tu? Kita panggil apa VII tu? Kita tak panggil faktor VII kan? Itu faktor, dia nombor. Tu dia dalam Roman tu. So apa faktor nombor apa tu? Ah.
2 7.
Number 7. Sebab V tu is 5 V tu 5, I tu 1, 1. So 5 tambah 1, 1 is 7 lah. Okey, lagi apa? Apa lagi factors yang ada dalam extrinsic tu, Hayati? Ada 2 tu.
3.
Ha?
3.
Number 3. Yeah, so 2 coagulation factors under the extrinsic pathway, which is number 3 and also number 7. So number 3, the synonym for factor number 3 is the tissue factor or thromboplastin. Yeah, while number 7, usually the other name of factor number 7 is proconvertin and stable factor. Okay. Now, how about the intrinsic pathway? Nak bahan? The one and only gentleman in this class beside me.
Sorry, Doctor, can you repeat the question?
Okay, my question is, can you name the coagulation factors under the intrinsic pathway?
Okay. Under the intrinsic pathway, they have hegemon factor,
Okay, which
which
is number
is number 12.
number 12. Next,
And also 11, factor 11,
factor 11,
and factor 9,
factor 9,
and also the 13, factor 13.
factor
13.
13.
No, factor 8.
Yeah, factor 8. Terkejut saya. Alright.
So,
Okay. Alright. So ada 4 factors under the intrinsic pathway, which is involved the 12, 11, 9, and 8. So the synonym factors, the other names for factor number 8 will be the anti-hemophilic factor. The other synonym name for the factor number 9 will be the Christmas factor. And then hegemon factor for the factor number 12, and plasma thromboplastin antecedent will be the factor number 11. Now, how about the common pathway? The coagulation factors that involve under the common pathway. Shakira. Then, okay, 5, 2, which is factor number 13. Great. Okay, so the common pathway, the coagulation cascade involve the intrinsic pathway, the extrinsic pathway, the common pathway. Just untuk recall balik, this coagulation cascade is under primary or secondary hemostasis? Yes, under the secondary hemostasis. Okay. Reason saya recall balik pasal benda ni sebab dia akan lebih faham lagi untuk next coagulation punya cascade test tu. Okay. Alright. Beside all the coagulation factors, ada juga a certain compound or molecule yang involved in coagulation cascade, which is the calcium. The calcium Ca2+ tu. Okay. Okay, so far okay. Kita tak masuk. Okay, kita belum masuk yang realnya. Ini yang kita refresh baru. Okay. Now we go to the first one, which is the prothrombin time. The prothrombin time. So basically, what is the prothrombin time or PT? PT. Start to familiar with the PT, with the APTT. Sebab this short form nanti you guys akan jumpa dalam lab, especially bila keluar result dalam list result di lab tu, dia tak akan keluar full name, tak akan tulis PT, APTT, TT. So start to familiar with this, especially bila in the lab of hematology lah di hospital. So the prothrombin time is a one-stage test based upon the time required for a fibrin clot to form after the addition of tissue factor, phospholipid, calcium to decalcified platelet poor plasma. So in principle, the PT or the prothrombin time measures the activity of the so-called extrinsic and common pathway of coagulation, and therefore is dependent on the functional activity of factors number 7, number 10, number 5, number 2, also known as prothrombin and fibrinogen. Okay, so just ingat balik semula, the pathway, the coagulation pathway, but for prothrombin time is specifically measure untuk dua pathway, which is the extrinsic and the common pathway. So recall balik, in the extrinsic coagulation cascade, it involves two main factors, which is number 3 and also number 7. Okay, so the clotting cascade, the factors that affect in the prothrombin time are shown in blue. Kalau lihat pada figure ni, it involves the extrinsic pathway and also the common pathway. Okay, so dalam extrinsic pathway ni ada dua benda, which is factor number 3 and also number 7, and the rest ialah common pathway. Intrinsic pathway tak terlibat dalam measuring the prothrombin time. Okay, now, so how kita perform atau kita nak measure this prothrombin time? Just bear in your mind, bila melibatkan prothrombin time, bermaksud apa yang kita akan dapat at the end is masa. Masa. So usually in prothrombin time, kita akan lihat berapa tempoh masa. Jadi the unit will be in second, not in minutes. Okay. So basically, in prothrombin time, a sample of the patient's blood is obtained by venipuncture. So you guys dah buat this venipuncture last week. Ada yang tak dapat, ada yang dapat, tak apa, nanti practice lagi. And the blood is decalcified. Decalcified. Remember, dalam coagulation cascade ada involvement of calcium tadi. The blood is decalcified by collecting the blood into a tube with oxalate or citrate ions to prevent the clotting process from starting before the test. Kita akan masukkan usually dalam test tube, yang dalam tube itu ada the oxalate or citrate ions. And then the blood cells are separated from the liquid part of blood by centrifugation. Just bear in your mind, dalam prothrombin time, sample yang kita measure is not blood cell, it's a plasma. Jadi how to separate between the plasma and also between the cells is obviously by using the centrifuge. Okay, so the PT test or the prothrombin test is performed by adding the patient's plasma to some source of tissue factor. Okay, kita akan tambahkan the plasma, kita gunakan istilah PPP, the platelet poor plasma is mixed with tissue factor, and then these tissue factors containing a protein, for example phospholipid or thromboplastin, that converts the prothrombin to thrombin. Okay, and then benda ni dilakukan dalam water bath 37 degrees. The reason of 37 degrees is because it's mimic to the human body punya temperature, and excess of calcium chloride is added to initiate coagulation. Dekat sini kena ingat ada penggunaan kalsium di sini, ada penambahan kalsium di sini. Because apa? Kalau you guys remember, dalam coagulation cascade ada the involvement of the calcium in order to proceed for the coagulation. Okay. So the calcium chloride is added to the mixture in order to counteract the sodium citrate and allow the clotting start. Okay, sebab tadi peringkat awal bila kita collect sampel, kita decalcified. Kenapa kita decalcified? Kita tak nak ada kalsium, sebab kalau ada kalsium dia akan menyebabkan berlakunya coagulation. So peringkat awal bila kita ambil blood tu kita kena decalcified in order to prevent daripada blood tu clot sebelum kita perform the test. Okay, tapi bila kita dah discard the blood cells, kita dah tambah dengan tissue factor, kita nak start initiate the coagulation, we need to add the calcium. In this particular test, we add with the calcium chloride. In the manual technique, at the same time as the calcium is added, a stopwatch is started and stop when the clot forms. So basically, this test is time from the addition of apa? From the addition of the calcium until the plasma clot. Jadi tempoh masa from the calcium kita masukkan tu, kita tambah calcium, and then they start to tambah calcium terus start time. Tambah calcium start time, kita tengok berapa lama dia clotting tu. Okay, the time taken from the addition of calcium to the formation of the fibrin clot, ni kita mainkan sebagai as a PT or pro-thrombin time. Okay, so in an automated system, the formation of the clot is detected electronically, but the principles are identical. So usually dalam lab kita tak buat secara manual macam ni, tambah. Tak, biasanya kita dah ada machine. Tapi the principle is same. The principle is same. Kita tambah calcium. Bila dah tambah calcium, start the plasma to clot, and then tempoh masa tu that's called as a prothrombin time. Okay? Is it clear as for now for prothrombin time?
Yes.
Yeah.
Okay. Okay, so ini antara reagents that been used or that will be used in order to measure the prothrombin time. Obviously, kita perlukan plasma, the platelet poor plasma. Then we need this tissue factor that contain the phospholipid. And these tissue factors bind to factor number 7 and initiates the coagulation. The exogenous phospholipid is used to replace platelet phospholipid. Sebab benda ni berlaku di luar daripada badan, jadi dalam lab, jadi kadang-kadang kita perlu tambahkan certain chemicals or reagent. And then the calcium required for recalcification, because remember the plasma sample is citrated to inhibit clot formation when the blood sample is collected. Remember bila kita collect blood tu, bila kita asing, bila kita mula-mula start collect the blood, kita letakkan dalam satu tube. The tube ada citrate. This citrate this berfungsi untuk inhibit the formation of clot. Kalau dalam the tube tak ada citrate, apa yang berlaku? Kita masuk dalam tube, dia terus clot, sia-sia lah, tak boleh nak buat prothrombin time, tak boleh nak measure the prothrombin time. Okay. Okay, so the reference range depends upon a number of variables, including the source of tissue factor. Is it using the human or is it using the rabbit tissue factor? And the exact technique used by manually or automated. And the method of endpoint determination is by is it using optical or mechanical? Ada banyak cara untuk kita determine the prothrombin time. Maybe mungkin secara optical ataupun secara mechanical. So each laboratory should establish its own normal range. Usually each laboratory akan ada dia punya own normal range. But in general, the prothrombin time for a normal plasma sample is 13. So sekejap saja, it's 13 to 15 seconds. Walaupun each laboratory establish own normal range, tapi tak ada yang ada labs yang establish normal range dia more than 1 minute. Tak ada certain lab dia punya prothrombin time dia 5 ke 10 minit. Maksud tu itu salah dah untuk normal. Usually dia akan less than 1 minute. In fact, less than 20 seconds. Less than 20 seconds. So in general, the prothrombin time is 13 to 15 seconds. Okay. So kalau dia lebih atau kurang, kita boleh dapat kita boleh interpret the results. The patient maybe ada certain penyakit. Okay. So this flow chart shows how to investigate a prolonged PT, prolonged prothrombin time. So dalam prolonged prothrombin time, kalau ada berlakunya prolonged prothrombin time, we will proceed with the mixing study, or we call it as a correction study. So when the prothrombin or PT time is prolonged, so a correction study is performed by mixing equal parts of the test plasma and the control plasma and repeating the test with the mixture. Okay, so if the prolonged time is corrected, the study indicates a factor deficiency. Kalau the lack of corrections indicates the presence of an inhibitors in the patient plasma. So the common inhibitors are heparin, lupus anticoagulant, or an antibody to one of the coagulation factors. Okay, so ini mixing study ni kita tambahkan patient plasma patient dengan normal plasma ratio 1:1, ya, ratio 1. Kita nak identify bila dah buat tambahkan dengan normal plasma, this correction study ni kita boleh distinguish between a clotting factor deficiency and involve ataupun dia ada indicates the presence of an inhibitor in the patient's plasma. Okay, so kalau the PT corrected tapi dia punya asal tu prolonged prothrombin time, so maybe the patient ada factor deficiency, fibrinogen or vitamin K deficiency, vitamin K antagonist, or some DOACs. So DOACs is a direct oral anticoagulants. Okay, tapi kalau the patient punya bila dah measure the patient punya prothrombin time and prolong, kita proceed dengan mixing study, tambah dengan normal plasma, tak ada correction. So maybe ada kehadiran inhibitor present, or rarely we call it as a lupus anticoagulant. Okay, so nanti you guys akan tengok ada lagi penggunaan mixing studies or correction studies. So basically the mixing studies or correction studies is kita tambahkan ratio 1:1. 1:1 tu apa? Patient punya plasma and also a normal plasma. Okay, kita kalau nak value tu boleh diperbetulkan, bermaksud patient itu ada certain disease condition, pathological condition. Okay. Now, so kita dah lihat pada the PT, the prothrombin time. Now the activated partial thromboplastin time, or usually known as APTT. So the APTT in contrast to prothrombin time. Why in contrast? Because the APTT measure the activity of the intrinsic and common pathway of coagulations. So try to remember balik semula, tengok balik semula coagulation cascade tadi. So apa beza as for now? What would be the difference between the APTT and TT and PT ni, Akila?
The factors measured.
Okay, factor measured. Okay, kalau lihat dari segi betul tu. Kalau lihat dari segi activated partial thromboplastin time or APTT, kita measure common and also the intrinsic. Remember PT kita measure which coagulation cascade or which coagulation pathway.
Extrinsic and common.
Yes, extrinsic and common. Dua-dua PT dan APTT boleh measure the common pathway. Tapi the difference, one of the main difference untuk PT dengan APTT is APTT measure the intrinsic, while the PT measure the extrinsic. Okay, so the APTT is also known as the choline-cephalin clotting time, or KCCT, or partial thromboplastin time with choline, PTTK. So choline ni is a surface activator. So sekarang dulu terms yang digunakan is KCCT or PTTK, the involvement of choline, and this choline is a surface activator. Kita akan tengok this function of choline dalam measuring the APTT. Okay, in principles, So macam biasa, bila kita nak measure PT or APTT, the sample yang kita guna adalah blood. Yes, blood, tapi kita tak measure the blood cell, kita akan measure the plasma. So blood kita ambil melalui venipuncture macam biasa, and then kita separate the plasma dengan blood cell by centrifugation. So the platelet poor plasma is incubated at 37 degrees, obviously because kita nak mimic the human temperature. Then phospholipid cephalin and a contact activator such as kaolin, micronized silica or ellagic acid are added, and this leads to the conversion of factor number 11. But the remainder of the pathway is not activated as no calcium is present. And then the addition of calcium, kita pre-warm this calcium to 37 degrees, initiates clotting and the timer is started. So the APTT is the time taken from the addition of calcium to the formation of fibrin clot. Okay, kalau ingat balik intrinsic pathway involve how many factors? How many coagulation factors involved in intrinsic pathway? How many coagulation factors are involved in intrinsic pathway? Kalau ingat balik tadi, kita refresh tadi kan? 4. Okay, 4, which is 12, 11, 9 and 8. Okay, and kalau ingat lagi dalam pathway yang figure saya tunjuk tadi pun ada involvement of the calcium. So APT sama saja. Kita measure the APT by when kita add the calcium and then start to formation of fibrin clot. Masa tu kita akan measure the APTT time. Okay, still bila APTT time involve the unit yang kita gunakan adalah in second. Okay. Okay, so most laboratories use an automated method for the APT in which clot formation is deemed to have occur when the optical density of the mixture has exceeded a certain threshold, and the clot formation makes the mixture more opaque and less light passes through, and the clotting cascade, the factors that affect the APTT are shown in blue. Okay, so kalau tadi, remember the PT involve the extrinsic pathway and the common pathway, tapi dalam APTT involve two pathway, which is the the intrinsic pathway dan juga the common pathway. Okay, the common pathway. So macam mana kita perform? How we perform this APTT in the lab? So the methodology, the APTT test use blood which is decalcified. The reason of decalcification to prevent clotting before the test begins. Sebab kalau masuk collect blood tapi blood dah clot, sia-sia waktu kerja tu. Sebab tu kita akan decalcified to prevent the clotting before the test begin, and the plasma is separated by the centrifugation. Still kita gunakan sample PPP, which is the platelet poor plasma. Is incubated at 37 degrees with a phospholipid cephalin, and the contact activator ataupun surface activator, for example kaolin ataupun ada juga yang tadi yang lain-lain tu, is added followed by the calcium. And all this is pre-warmed to 37 degrees, and the addition of calcium initiates clotting and timing begins. And the APT is the time taken for a fibrin clot to form. Initial incubation times may vary from 2 to 10 minutes. Okay. Okay. All right. So ini the reagents that usually been used in APTT. Obviously, sample yang kita gunakan adalah plasma, and ada involve the surface activator with the kaolin or micronized silica or silite or ellagic acid. It is surface activator. Kita juga ada phospholipid and calcium. This phospholipid and calcium, ada tak reagent ni been used in the PT time?
Ada.
Ada. Okay, ada. Tapi is there any surface activator been used dalam PT in measuring the PT time? Tak ada. Okay, tak ada. Okay, this saya highlightkan benda ni because at the end kita boleh tahu the differences between the PT dan APTT. It's not only measuring what kind of pathway, it also involve in terms of the reagents that have been used in order to measure the time. Okay, the time. Okay, now this the prolonged abnormality, apa yang berlaku kalau berlaku dari segi delay ataupun panjang time APTT itu. For example, kita boleh interpret banyak segi disease or pathological conditions. Okay, the deficiency of either factors number 12, number 11, number 9, number 8, obviously sebab these 4 factors is dalam intrinsic punya pathway. However, the APTT can be normal with mild deficiency of these clotting factors. In general, the deficient factor has to be less than 20 to 40% of normal before the APTT is prolonged. So, dia boleh lihat kat sini, bila ada prolonged APTT, mungkin the patient is kekurangan or deficiency of factor in intrinsic pathway. And then contact factor deficiency, pre-kallikrein deficiency or HMWK deficiency. What is HMWK? High molecular weight kininogen deficiency. Kalau ingat balik dalam pathway, intrinsic pathway tu, dia ada involvement of HMWK. And then in multiple clotting factors deficiencies, the APTT becomes prolonged with less severe reductions in factor levels. Acquired clotting factor inhibitors, and these are most commonly directed against F8 and may occur as either autoantibodies, maybe acquired hemophilia A or allo antibodies. Following exposure to exogenous factor number 8, the use of factor 8 concentrate to treat a bleed. Inhibitors against other clotting factors are rare but do occur factor number 5, for example. And also mungkin interpretationnya adalah lupus anticoagulant. Lupus anticoagulant, a target phospholipid and so can result in an isolated prolongation of the APTT. Although the PT requires phospholipid, the concentration of phospholipid in PL ni phospholipid in the PT reagent is high, and so it frequently neutralize the lupus anticoagulant, and so the PT is not prolonged. Okay, so basically bila ada prolonged APTT time, it boleh bagi certain interpretations of pathological conditions. Now my question is, okay, in terms of the time PT dengan APTT tadi, okay, you guys rasa APTT ni berapa tempoh masa yang normal untuk APTT ni? Normal. Berapa? Adakah dia lebih lama daripada PT ataupun dia lebih cepat daripada PT punya time? My question.
Lebih lama.
Yes, Fariha, apa?
Lebih lama sebab dia
Why?
lagi banyak faktor.
Yes, great. Kalau you guys ingat balik pasal the APTT dia measure about the intrinsic pathway. Kalau tengok intrinsic pathway, dia punya arrow gerbak-gerbuk semua tu, daripada atas sampai bawah tu agak panjang. Jadi usually the normal range untuk APTT akan lebih panjang sikit as compared to the PT time, but still in seconds, not in minute. All right, so the reference range for the APTT, the clotting time for the APTT lies between 27 to 35 seconds. Kalau tadi ingat pada PT, the PT time is less than 20 second. However, this varies widely between laboratories and is dependent upon a number of variables, including whether the test is automated or manual, and the type of activator and the incubation times employed in the test. Ini adalah asas measuring the ability, tapi usually sekarang kita dah tak buat secara manual, more on using a machine ataupun analyzer. Okay. Okay, ni mixing study. Kalau you guys remember tadi dalam PT pun saya discuss about the mixing study. Okay, so basic principles of PT, prothrombin and APTT mixing studies. So these mixing studies may either be immediate PT or APTT measured immediately after mixing, or incubated APTT measured after mix incubated for 1 to 2 hours at 37 degrees. And then measure the APTT. The patient plasma and normal pool plasma may be mixed in different ratios, but usually ratio yang kita gunakan is 1:1 lah, 1:1 plasma. If the clotting time corrects after the mixing, so the interpretation will be this slightly represent factor deficiency. If the clotting time does not correct after the mixing, this pattern likely represents an inhibitor. Okay, so this mixing study, basic principle-nya adalah kita mix apa dengan apa. We mix the patient punya plasma and a normal punya plasma. The ratio usually, maybe it can be 4:1 or 1:1, tapi usually is 1:1. Kalau awalnya is a prolonged PT or is a prolonged APTT, kan? Kita tambah dengan normal plasma and then correct masa tu, is interpreted maybe the patient is prolonged PT or APTT because of factor deficiency. Tapi if the patient plasma mixed dengan normal plasma and then the value is not correct after the mixing, so most likely is represent as a inhibitor punya pattern. Okay, but this kind of mixing study is very important sebab it can give banyak interpretation. Ni contoh lah, kita go detail lah. So this mixing study, again, mixing study in which patient plasma is mixed with a normal plasma, ratio 1:1. So basically this mixing study help to distinguish between clotting factor deficiency and an inhibitor. So if the mixture fails to correct the ability within 3 to 4 seconds, this is strongly suggestive coagulation factor inhibitor or an antiphospholipid antibody such as lupus anticoagulant. So this ni dia punya flow ni macam-macam lah, ya. Tapi kalau you guys lihat this PT, APTT screen normal, kita tak payah buat apa-apa lah, right? Tapi kalau dia prolong PT or APTT, that's why kita akan proceed dengan mixing plasma. Okay, so nanti bila adalah dia punya kalau ada elevated TT, normal TT, TT ni apa pula? TT ni ialah thrombin time, ya, thrombin time. Okay, so start to familiar, PT lah, TT lah, APTT lah, semua TT yang belakang tu obviously pasal time. Okay, so basically this the mixing study for APTT incubated, sama saja dia applykan kepada mixing study for the PT incubated juga. Okay, perlu hafal ke benda ni doktor? Tak perlu hafal pun. Saya tak tanya pun benda ni dalam exam. Saya tahu you guys tak risau sebab dia banyak sangat error. Tak, kita just nak lihat kepentingan signifikannya this mixing study. Okay, now this table bagi the result interpretation of APTT and PT. So you guys dah clear dari segi perbezaan antara PT dengan APTT in terms of the reagents, in terms of factor yang di measure, pathway yang terlibat. Okay. So once we receive the result, we as a science officer, you guys kan science officer nanti dekat mana-mana hospital, private ataupun government or any other private lab. So kalau dapat results the PT is prolonged, tapi the APTT is normal. So it might be the patient is factor 7 deficiency, or maybe mild vitamin K deficiency, liver disease, involved of warfarin, or DIC. DIC is disseminated intravascular coagulation. Is a condition in which the blood clots from throughout the body, blocking a small blood vessel, small blood vessels. So mungkin the patient ada liver disease, the warfarin, multivitamin or factor 7 deficiency, and also the DIC. Tapi kalau the patient's normal in terms of the value of the PT, but the prolonged APTT, maybe the deficiency of factor 8, 9 or 11, or maybe deficiency of factor 12, or maybe ada VWD, von Willebrand disease, or maybe ada penggunaan heparin, dabigatran, agatroban, or maybe a direct factor of number 10 inhibitors, maybe it acquire inhibitor of factor number 8, 9, 11 and 12, maybe because of acquired von Willebrand syndrome, or maybe because of lupus anticoagulant. Okay, so each of this PT or APTT, bila kita combine result tu, kita boleh dapat the pattern, or kita boleh interpret the pathological conditions of the patient. Okay, or maybe dua-dua prolong, the PT prolong and the APTT prolong. Maybe deficiency of prothrombin, fibrinogen, factor 5 or factor 10, or combined factor deficiency. Obviously kalau dua-dua ni prolong, recall balik, maybe kalau you guys tengok dia prothrombin, deficiency of prothrombin, fibrinogen, factor 5, factor 10. Ini semua dalam which pathway? Prothrombin, fibrinogen, factor number 5, factor number 10, dalam which pathway? Common pathway. Bila common pathway ada deficiency, you guys rasa tak affected pada PT dengan APTT? Yes, sebab dua-dua PT and APTT akan measure also the common pathway. Okay, so maybe juga the patient's combined factor deficiencies, or maybe the liver disease, DIC, severe vitamin K deficiency, or maybe involvement of the anticoagulants, acquired inhibitor of prothrombin, fibrinogen factor 5 or factor 10, or amyloidosis associated for factor number 10 deficiency. Okay, kalau you guys tengok dalam the course of the test result pattern ni, you guys akan nampak mesti ada perkataan liver disease tu. Why liver disease tu agaknya? Bila melibatkan PT, APTT, liver disease, why? Mesti ada masalah pada liver. Why? Kenapa dia tak ada menyebabkan masalah pada GIT ke, or masalah pada brain ke, or masalah pada lung ke, or masalah pada any other organs? Why liver disease? Ada tak agak?
Sebab liver produce the coagulant factors.
Yes, great. Because the coagulation factors, the production side, or the main organ that produce the coagulation factors is the liver. So kalau liver masalah, obviously akan affect kepada production quantity or quality of the coagulation factors. Okay. Now we're done with the PT, we're done with the APTT. Now we go to the TT, which is the thrombin time. Okay, you guys need a break ataupun kita boleh proceed lagi? Boleh proceed?
To you, Doctor.
Oh, okay. Sebab you guys ada kelas pukul 11 juga, kita try habis awal sikit lah. Okay. Boleh lagi absorb Boleh Okay. Saya harap boleh lah absorb sikit-sikit pagi ni kan. Alright, so now we go to the thrombin time. So in principle, basically the thrombin time is measure how well fibrinogen is working. How well is fibrinogen is working. So abnormal results may be due to inherited like a fibrinogen disorder, or maybe liver disease, or maybe some cancers and medications that affect the clothing. So obviously dalam thrombin time, apa pathway yang terlibat dalam thrombin time ni? Common. Kenapa common?
The measure thrombin.
Yes, because they measure the fibrinogen. And obviously the fibrinogen of factor number 1 ada dalam common pathway. Okay, so in principle, the thrombin times involve only the addition of bovine or human thrombin to saturated the platelet poor plasma. It therefore reflects the conversion of fibrinogen to fibrin, but it's also sensitive to presence of inhibitors that may be present in the plasma, for example, heparin. So the diagrams show the stage involved in the thrombin time, shown in the blue. So kalau tengok tadi untuk thrombin time, kita, okay, dari segi fibrinogen tadi. Fibrinogen which is involved in the common pathway. Common pathway. So in principle, they just add the bovine or human thrombin ke dalam plasma. So, okay. So the methodology for the thrombin time, TT, human thrombin or bovine thrombin is added to platelet poor plasma, PPP, at 37 degrees, and the time taken for the formation of fibrin clot recorded. And then recalcification of the plasma is not necessary. So berbeza dengan PT and APTT, the reagent that involve in order to perform the PT and APTT lebih banyak lagi. But in thrombin time is very simple, which is involve the human or bovine thrombin. So historically, bovine thrombin was used in this test, but is now frequently replaced by human thrombin. Sebelum ni kita gunakan bovine thrombin. Kenapa bovine thrombin? Because lebih mudah untuk dapatkan bovine thrombin as compared to human thrombin. Tapi selepas tu ada apa orang kata isu or kontroversi kenapa nak tambahkan human plasma with the binatang punya thrombin. That's why sekarang kita dah cuba untuk menggunakan human thrombin instead of gunakan bovine thrombin. So basically in TT time, benda yang perlu adalah untuk kita measure this TT is thrombin. Okay. Okay, interpretation. The thrombin time will in general be prolonged when functional fibrinogen levels are less than 1 gram per liter. And the reference range, each laboratory must establish its own reference range, but in general, the reference range for the thrombin time is in the region of 13 to 15 seconds. Lebih rendah daripada masa yang digunakan untuk measure the APTT. Okay. Sebab dalam TT lebih singkat lagi pathway dia. Alright. Okay, this is contoh lagi flow yang mana melibatkan prolonged APTT and thrombin time. Okay, so bila ada prolonged thrombin time, dia dah prolong APTT, lepas tu thrombin time dia buat pula measure prolong thrombin time, kita buat lah reptilis time, ini ada additional test. Kalau normal mungkin ada heparin present, tapi kalau prolong kita proceed lagi dengan fibrinogen assay. Kalau normal mungkin ada faktor-faktor yang terlibat yang disorder. So kalau prolong APTT tapi dia punya normal thrombin time is normal, kita buat mixing study. Remember mixing study kita tambah apa? Kita tambah patient punya plasma dengan normal plasma. Kalau ada correction, kalau prothrombin dia prolong, proceed dengan fibrinogen assay. So dapatlah mungkin DIC ataupun hypofibrinogenemia or dysfibrinogenemia. So just remember yang bila melibatkan mixing study mesti ada perkataan correction. Sebab kita nak correctkan value tu yang dah prolong tu, kita tambah dengan normal plasma dan how the plasma react. Okay, so flow ni macam ni lah, melibatkan APTT, TT, and then ada fibrinogen assay. So at the end baru kita boleh identify patient ni ada masalah apa. Okay, dia tak boleh depends only one single PT or one single APTT punya results. It involve banyak components or parameters. Parameters. Now, next is the fibrinogen assays. Fibrinogen assays. Okay, kejap So we've learned, discussed about the PT, about APTT, about the TT. Now it is the fibrinogen assays. So fibrinogen defects may be quantitative or qualitative. Kalau quanti melibatkan bilangan, numbers. Kalau kurang, you can call it as a hypo ataupun hyper fibrinogenemia. Kalau melibatkan dari segi structure daripada function, we call it as a qualitative defect. For example, dysfibrinogenemia. Okay, dysfibrinogenemia. So basically, dysfibrinogenemia is a coagulation disorder, and usually it characterized by having an abnormal form of fibrinogen. Structure dia abnormal. So inherited dysfibrinogenemia is rare, but an acquired defect of fibrinogen function is more common, especially in liver disease. The fibrinogen levels may also be reduced in liver disease due to reduced synthesis, and elevated levels of fibrin degradation products, FDP, also impair the conversion of fibrinogen to fibrin. When I talk about the FDP or fibrin degradation products, is a substance that remain in your bloodstream after your body dissolve a blood clot. So another thing is elevated fibrinogen levels may kita boleh interpret or correlate with an increased risk of thrombosis in epidemiological study, although the significance in individual patient is unclear. Okay, so fibrinogen levels are important part of the investigation of bleeding tendency or an unexplained prolongation of the APTT or PT. So nak cakap ni kat sini adalah kita tak boleh depends only the PT, tidak boleh depends only on the APTT. It's not only depend on the TT. We also need to include the fibrinogen assays to perform in order to interpret what happened to the patient actually. Okay. So in principles, there are a number of assays for measuring the fibrinogen levels in plasma, although in practice most laboratory use the close method. So ada banyak sangat assay kita nak measure the fibrinogen ni, ada banyak sangat. Tapi yang biasanya we use to measure the level of the fibrinogen, it's cross method. So kita adalah class assay, ada PT drive fibrinogen assay, ada immunological assay, gravimetric assay, tag and rotem assay. But the most commonly used laboratory method for measuring the fibrinogen is the cross fibrinogen assay. So basically, this cross fibrinogen assay is quantitative, is a clot base, is a functional assay, and basically this clot method measure the ability of fibrinogen to form fibrin clot after being exposed to a high concentration of purified thrombin. Okay, so basically the clot method ni kita akan measure apa? Kita akan measure the ability of apa? Ability of fibrinogen. Fibrinogen tu untuk bentuk apa? Untuk bentuk fibrin clot. Macam mana dia bentuk fibrin clot after being exposed to a high concentration of purified thrombin. Okay, just refer balik semula kepada the pathway. Okay. Tag ni TEG rotem ni, this is a machine. Dia machine. The tag and rotem machines can also be used to provide a qualitative indication of the fibrinogen concentration. So basically, tag is a thromboelastography. Elastography. Oh, tak apalah, nanti you guys cari Ini saya pakai mouse je ni. Thromboelastography. And then kalau rotem ialah rotational thromboelastometry. Okay. So the diagrams illustrate the cross method for measuring fibrinogen. The cross-linking of fibrin by factor number 13 is not required for the cross fibrinogen assay, and so the fibrinogen level will be normal in severe factor number 13 deficiency. So ini sebab kita measure the fibrinogen level. So once kita measure the fibrinogen level, bermaksud result yang kita akan dapat sama ada tinggi ataupun rendah, dan bukan in seconds. Bukan we are not measuring the time, we are measuring the level. Okay, so the reference range for fibrinogen is generally 1 to 1.5 to 4 gram per liter. So kalau the fibrinogen levels are reduced, okay, kejap bagi saya few minutes. Okay, so in terms of the interpretation for the fibrinogen level, so when we talk about the fibrinogen levels are reduced, it may be the DIC, disseminated intravascular coagulation, or maybe liver disease or massive transfusion leading to dilutional coagulopathy, maybe because of the inherited deficiencies, maybe following by the thrombolytic therapy, in some patients following treatment with asparaginase, maybe because they're primary hyperfibrinolysis, and this has been reported in individuals with carcinoma of the prostate and other cancers. And how about if the fibrinogen levels are increased? It may be because of the increasing age, maybe of female sex, pregnancy or oral contraception, maybe because of the post-menopause women, maybe because of acute phase reaction, or maybe because of disseminated malignancy. Okay, so the interpretation, kalau once we measure the fibrinogen level tinggi atau rendah, so they interpret the pathological condition. Okay. Now, ini summary keseluruhan. Summary keseluruhan bila kita involve first we involve the platelet count, the PT, the APTT, the TT, the fibrinogen. Barulah kita boleh baru kita boleh mudah lagi untuk interpret the condition of the patient. Okay, so usually the platelet count, all platelet count must be verified by a blood smear, ataupun kadang-kadang kita boleh gunakan terus dengan mesin. So kalau the platelet count normal, PT normal, semua normal profile lah. Or maybe ada slightly a factor 13 deficiency, maybe. Okay, tapi kalau platelet count dia normal, PT dia high, prolong, normal APTT, normal TT, normal fibrinogen, maybe because of deficiency of factor number 7. But how about if the platelet count is normal, the PT is normal, but the APTT is prolonged or high, the other TT and also the fibrinogen is in normal range, maybe the deficiency of factor number 8, 9, 11 and 12 deficiency, maybe because of VWD disease, von Willebrand disease, maybe because of lupus anticoagulant, maybe because of other factor deficiency like HMWK or pre-kallikrein. Okay, this interpretation reflect balik kepada APTT ini involve which pathway. Okay, kalau semua normal tapi APTT yang masalah, right? Samalah juga dengan if the platelet count is normal, the PT is high, the APTT is high, but the TT is normal, the fibrinogen normal. So the interpretation will be the common pathway is maybe the deficiency of factor number 2, number 5 or number 10. Maybe the multiple clotting factor deficiency, maybe involvement of warfarin or vitamin K antagonist, maybe because of vitamin K deficiency, maybe because of very strong lupus anticoagulant. And if semuanya haywire, platelet count dia rendah, the PT dia tinggi, the APTT dia tinggi, the TT also prolonged, the fibrinogen is low, and most probably because of DIC, massive transfusion, or paling senang, bukan paling senang, maksudnya senang kita nak interpret, ada masalah kepada apa? Masalah pada to the production side or to the organ, which is the liver. Which is the liver. What happened kalau the platelet count yang normal, tapi dia ada coagulation test, screening test, semuanya normal. PT normal, APTT normal, TT normal, fibrinogen level pun normal. Maybe because of primary platelet problem. Maybe platelet problem. So mungkin tak ada kaitan dengan coagulation factors punya deficiency. Okay. So the mean platelet volume MPV can be helpful in establishing the cause of thrombocytopenia. What is thrombocytopenia by the way? Daripada term ni pun boleh tahu dah thrombocytopenia. Apa itu thrombocytopenia?
Low platelet.
Apa? Low blood platelet count. Low blood platelet count. So a raised MPV is often associated with increased peripheral destruction, whereas a reduced MPV is often association with bone marrow failure. A raised MPV can also be found in number of inherited qualitative platelet disorder. Changes in the MPV are also seen in patients with various inherited platelet disorder, Wiskott-Atteridge syndrome, and in which the MPV is significantly decreased. Okay. So by the way, the ITP is referred to the immune thrombocytopenia. Immune thrombocytopenia. Okay. All right. So we've done with the PT, APTT, TT, fibrinogen assay. Now we go to the last part, which is the platelet function testing. Dalam usually dalam when we guys dapat result lab result di hematology or immunohematology punya lab, dia akan keluarkan dalam list tu PT, APTT, TT, fibrinogen. Itu standard itu standard. And then sometimes kita akan buat further testing which is involve the platelet function testing. Okay, when we talk about platelet function testing, is nothing to do with the coagulation punya factors. Okay. So in platelet function testing, an evaluation of patients with abnormal bleeding symptoms requires an objective assessment of the bleeding history, a physical examination, a careful drug history, and followed by laboratory investigations. So usually the laboratory tests for platelet disorder may include, kita akan assess the platelet number and size. Kita akan assess the platelet morphology. Obviously kita akan based on blood film. Kita akan screening test of platelet function. Contohnya kita akan measure the activated clotting time, ACT, or bleeding time, and PFA 100. PFA is referred to platelet function analyzer. Or maybe kita akan buat light transmission aggregometry classically, or kita akan buat impedance platelet aggregometry, or kita akan measure atau buat test platelet works for monitoring the response of platelets to antiplatelet therapy, atau kita akan guna je analyzer PFA 100 ataupun PFA 200, pakai je mesin the platelet function analyzer, atau kita akan buat global thrombosis test, ataupun kita gunakan mesin TAC or Rotem tadi, ataupun assess the platelet nucleotides, or measure the thromboxane metabolites by ELISA. I believe you guys familiar dengan ELISA kan, enzyme link tu. And then kita boleh juga guna flow cytometry, and then this flow cytometry pun you guys dah tahu the principle of flow cytometry to quantitate the presence of absent or platelet membrane glycoproteins, and also kita boleh proceed dengan mutational analysis. Okay, flow cytometry, you guys learn about flow cytometry kan?
Yes.
Okay. Dalam flow cytometry kita boleh identify dari segi granular, dari segi size of cell tu sendiri. Okay. So this is classification of platelet disorder. Okay. So kalau ada mucocutaneous bleeding, so usually initial investigations involve the FBC, full blood count, and then mungkin akan proceed dengan blood film, coagulation profile, liver function test, and platelet function test. And kalau after the initial investigation berlakunya thrombocytopenia, which is a condition in which you have a low blood platelet count, kita akan proceed dengan mean platelet volume. Kalau low, so dia akan ada possibility the interpretation will be the inherited disorder ataupun acquired disorder. Ini senarai-senarai penyakit or pathological conditions that might contribute to kenapa berlakunya low thrombocytopenia. Kalau normal, MPV pun mungkin kita kena consider mungkin ada serta-serta penyakit yang mungkin berlaku juga sebab dia ada mucocutaneous bleeding kan, history dia. Tapi kalau ada increase involvement of neutrophil inclusion, kalau yes, mungkin ada certain penyakit, May-Hecklin syndrome, Sebastian syndrome. Kalau after the neutrophil inclusion tidak ada apa-apa on negative neutrophil inclusion, maybe ada certain penyakit. Ini list penyakit je lah. Okay. Panjang penyakit ni, tapi kita tak boleh nak discuss in details setiap ni. Saya just listkan saja sebab you guys more on the diagnosis part. Okay. Jadi sebab tu kita banyak bincangkan more on the methodology or the principle of measuring the time or the level. Okay. Okay, so far ada apa-apa soalan? Saya rasa ada lagi yang tak masuk. Betul tak? Betul tak Syakira? Ya. Yeah. Sebab kalau kan 29 campur saya sepatutnya 30. Ni baru 26. Just make sure yang dah masuk, klik I attend tu klik I attend tu. Link tu. Okay, ada so far ada apa soalan? Ya, ada apa-apa soalan? Sebelum kita proceed lagi. Tak ada soalan. Tak ada soalan, saya bagi soalan. Okay. You go to the knowledge check. Okay. Banyak dah. Saya rasa dah berasap dah kepala masing-masing dengan nama penyakit yang pelbagai tu. Tapi sebelum saya end the session, at least you guys ada juga dapat knowledge from session pagi ni. Ya, jadi kita nak reflect balik semula, a knowledge check. A knowledge check. Okay, now saya ada bagi kat sini ada 4 statements kat sini. Yeah. The first is the opposite of hemostasis is what? The extrinsic and common pathway are tested by what test? The intrinsic and common pathway are tested by what test? And the final conversion of F1 or fibrinogen to fibrin is tested by which test? Cuba try to figure out what will be the possible answer on these 4 statements. Ini kita reflect balik semula apa yang kita sudah belajar tadi ya. Jangan cakap lagi. Saya panggil nama. Okay. Mungkin tu start dengan yang first. The opposite of hemostasis is what? Mungkin Syafiqah ada? The opposite of hemostasis is what?
Homeostasis.
Homeostasis. Opposite. Lawan kepada hemostasis. Agak-agak apa? Apa dia? Syafiqah dia?
Ada.
Boleh. Agak-agaknya apa? Dia bukan perbezaan antara hemostasis dengan homeostasis. Tapi konsep hemostasis tu apa berlawanan dengan konsep hemostasis tu?
Hemorrhage.
Yes, hemorrhage. Thank you. Okay, thank you. Number two, maybe can we have Fadilah Fauzi. Fadilah Fauzi ada?
Ada doktor. Sekejap,
Yeah. Okay. Jangan risau, salah ke betul ke tak apa. Just saya nak kita just reflect balik apa yang kita selalu belajar for the past 1.5 hours tadi. Mungkin Fadilah boleh jawab nombor 2 ni.
PT test.
PT test or what? PT test stand for? PT stand for?
Prothrombin time.
Yes, prothrombin time test. Great, thank you. Sharifah Dora,
Ni doktor.
how about number 3?
APTT.
APTT stand for?
Activated
Mhm.
partial
Uh-huh.
thromboplastin time.
Activated partial thromboplastin time. Yes, great, thank you. How about the last one? Maybe Haizatul Umiyah. Haizatul ada? Ada, Haizatul ada? Ke Haizatul tak ada? Okey, tak apa. Mungkin Intan Raihana? Intan Raihana ada?
Ada.
Okey. How about number 4 ni, Intan?
Thrombin test. Thrombin time test.
Thrombin time test. Great. Okay. Next. Now, boleh saya dapatkan Wan Nur Syahidah? Wan Nur Syahidah ada? Oh, okay, sebelum tu. So this two figures adalah berkaitan dengan the principles or the reagents that involve in measuring the coagulation disorder or screening test. Okay, yang A is present to measure apa, yang B is represent to measure apa. Tapi there must be a explanation lah kenapa you guys mention A ni adalah untuk measure B, measure apa, and B ni adalah untuk measure apa. Okay, so cuba tengok, try to identify apa hint yang ada on these figures, and these figures represent to measure what in A and in B. Okey. Ada dah boleh kita tengok jawapan. Boleh kita tengok jawapan. Bila saya dapatkan jawapan atau respon daripada Wan Nur Syahidah. Dia tak ada. Oh, okey. Boleh. Maybe Liana Ruslan boleh? Oh, tak ada juga. Ini okey, tak apa. Nanti maklumkan pada saya. Saya siapa yang tak ada ni. Hanis Fatini. Hanis Fatini ada? Hanis, boleh Hanis? Yang A tu untuk measure apa, Hanis? 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 Hanis tak ada? Mungkin pergi toilet agaknya. Tak apa. Nadia boleh? Nadia Fatihi ada? Ke tak ada? Nadia pun? Okey, kalau tak ada, mungkin boleh saya dapatkan Nur Alia. Alia Aziz.
Yang A, PT.
Alia, apa dia? Yang A, PT. Okey, kenapa PT?
Kenapa PT? Sebab dia letak kalsium.
Ha?
Yang faktor dia.
Apa yang faktor dia?
Faktor 7 dengan faktor apa?
Ha.
Faktor 7 dengan faktor 2.
Ada apa? Faktor 2? Faktor 2?
Faktor 7
Ha?
dia dalam extrinsic.
Extrinsic, okey, lagi?
Lepas tu dia guna kalsium.
Guna kalsium, okey, lagi?
Lepas tu faktor tu dalam common.
Faktor tu dalam?
Mungkin saya tak ingat lah doktor.
Okey, tak apa. Dia betul PT dah. Dia betul dah PT tu. The PT time tu is betul. One of the thing yang you guys need to consider ialah dalam PT, measuring the PT is kita tambah TF. Thromboplastin. TF or thromboplastin is tissue factor ataupun coagulation factor number. Number apa? TF coagulation factor number?
Number 3.
Number 3. Ya, number 3. Paling senang nak ingat paling senang nak ingat lah saya kata. PT ada dua faktor. PT tu pun ada dua je, P dengan T. Kalau tengok APTT ada berapa huruf kat situ? Ada 4. Bila APT tu 4 huruf, ini senang ingat APT ada 4 huruf, ada 4 factors yang terlibat. Bila 4 factors yang terlibat tu, is it intrinsic ataupun extrinsic punya pathway?
Intrinsic.
Intrinsic. Ya, kalau 4 tu APTT, nama pun APTT, ada 4 huruf APTT, itu melibatkan most probably ada 4 factors yang involved. Bila 4 factors yang involved itu adalah intrinsic. Sebab tu pada B ni adalah APTT. Okay. Another things yang you guys boleh tengok adalah kalau yang PT ni adalah thromboplastin punya involvement. Dari segi fosfolipid dengan kalsium, dua-dua ada. Ni. Measuring the PT or APTT, phospholipid, kalsium, dua-dua ada. Dua-dua penggunaan ada. Tapi benda yang reagent yang lain yang ditambah, kalau nak measure the PT, thromboplastin, tapi kalau nak measure dari segi APTT adalah ada surface activator ataupun ada kaolin tadi. Kaolin tadi. Okay. Alright, so we've done with our session today. So hopefully at least ada apa orang kata ada info yang dapat pada hari ini. Saya tak expect untuk you guys faham keseluruhannya sekali terus pada waktu sekarang ni. Mungkin you guys akan refer balik my lecture notes ni, and then kalau ada apa-apa query yang tak berapa clear, sila lah bertanya untuk dapatkan kepastian ataupun pemahaman. Okey. Sebelum saya tutup, ada apa-apa soalan? Okay, usually memang tak ada sebab mungkin you guys dah lapar nak pergi breakfast dulu sebelum kelas pukul 11. Okay, my last request to the one and only gentleman. Sorry, Nabahan. Nabahan ada? Ada tak? Nabahan Lutfi ada? Tak ada? Itu adik lah. Okey, tak apa. Okey, saya request seorang. I need one volunteer untuk summary, untuk wrap up apa yang you guys what have you learned today? What have you learned today? Maybe any volunteer before we end our session? Summary or wrap up balik semula, what have you learned in this session, this morning session? Ada seorang volunteer sebelum saya panggil nama? Saya punya style memang saya suka panggil nama. Bukan sebab untuk ni, tapi sebab saja untuk ada interaction, communication, two ways communication. Okay. Ada siapa boleh ni apa tu? Wrap up atau summary what have you learned today? Lama ni kalau saya tahan kalau tak ada siapa nak jadi volunteer. Ada? Tak ada? Bukan bagi tahu detail pun apa. Apa je benda yang dah belajar hari ni yang kita dah discuss. Ini volunteer? Tak ada.
Saya bagi tahu sikit je. Tak tahu boleh.
Siapa tu?
Masteri.
Okay, Masrina. Apa?
Okay, so hari ni kita belajar dua blood coagulation test. Satu prothrombin test, satu lagi activated partial thromboplastin. APTT time. Satu prothrombin time, satu APTT.
Okay.
Lepas tu dua ni ada beza sama ada dia extrinsic ataupun intrinsic dengan common ataupun ataupun tak common.
Dua common.
Dua common, okay.
Okay.
Lepas tu kalau PT dia extrinsic. Lepas tu dia guna satu factor 7 coagulation factor.
Okay.
Kalau APTT dia intrinsic, dia ada 4 coagulation factor. Lepas tu dia ada kaolin. Lepas tu itulah.
Okay. Thank you very much, Mas Rina. Okay, thank you very much. Mungkin ada tambahan lagi daripada Syahira? Syahira ada? Saya tak tambahan lagi apa yang biasa belajar hari ini. Tak ada Syahira. Mungkin siapa-siapa lagi, mungkin ada seorang lagi. Saya perlukan seorang lagi untuk siapa tu?
Hello?
Hello. Syahira Okay.
Ada Thrombin Time dengan Fibrinogen AC.
Okay. So dalam Thrombin Time tu kita measure apa dalam Thrombin Time tu?
Common Pathway.
Okay. Jauh dengar tu. Siapa yang jerit Common Pathway tu? Ini mesti roommate ni. Siapa yang jerit tadi? Common Pathway tu? Mungkin dia boleh Syaira? Cuba mention sikit siapa nama dia. Dia dah cover member. Okay. So Thrombin Time pasal masa, pasal time, pasal Common Pathway, and then kita ada Fibrinogen assay. Kita lihat dari segi level, bukan dari segi seconds, bukan lagi segi masa, sama ada tinggi ataupun rendah. Lepas tu ada satu summary table yang saya provide sekali, which is involve the platelet count, PT, APTT, TT, and also the fibrinogen level. Okay, and then also ada one particular platelet function test, and then list of platelet function tests. Okay, don't to forget about the mixing study or the correction study, which in mixing or correction study, involvement of the platelet, involvement of the patient's punya plasma at ratio 1:1 dengan normal plasma. So kalau corrected ada certain interpretation. Kalau it's not corrected, ada certain interpretation. Okay, alright. Saya rasa itu saja untuk sesi hari ini. Saya akan bagi link untuk certain yang further reading yang you guys boleh tengok. Kita jumpa insyaAllah next week untuk satu lagi topik. Kalau tak ada apa-apa soalan, thank you very much for your time and thank you very much for lending or pinjamkan your ear untuk my session today. Kalau tak ada apa-apa soalan, we close our session with tasbih kafarah. Bismillahirrahmanirrahim. Suratul As. Alright, thank you very much everybody. Stay safe. Assalamualaikum warahmatullahi wabarakatuh.